So I'm here with Dr Diarmuid McCoy, specialist pain medicine physician, and we're recording a number of video tutorials to help case managers and lawyers, other referrers to understand pain in all its formats and how to manage it on an ongoing basis, how to define it, how to effectively treat pain as well. The first video tutorial that we're going to look at today is on defining the pain. And I'd like to start, Diarmuid, by asking you, what is the definition of pain?
An excellent question and a difficult one to answer. In fact, it's interesting that even though we have experienced pain since man has walked on the planet, and indeed higher animals have walked on the planet, we've really only come up with the definition in the last 30 years. And the definition is an unpleasant sensory and emotional experience associated with actual or potential tissue damage expressed in those terms. Now, it seems a very awkward definition in the first instance, but when we see patients, particularly those with persistent non-cancer pain, this is actually quite a useful definition because it does bring into effect the sensory and emotional side and brings us on to the psychosocial biomedical approach to the management of pain.
So, Dr McCoy, what are the various approaches available for measuring pain?
So, over the last number of decades, I suppose, we have developed, or various scales have been developed. And in acute pain, that's pain after an operation or an injury, you can frequently be asked to measure on a scale of from 0 to 10 the actual level of pain. In fact, it is a unidimensional scale, quite useful in the operating room or in the post-operative care unit, but not as useful for persistent pain. So we have to look at other ways of measuring it and reflecting on the effect pain has on the individual. And so we use such scales as those that measure activities of daily living, such as the brief pain inventory, those that affect on anxiety, depression, catastrophizing, and self-efficacy. And self-efficacy is the ability of a person to depend on their own resources to manage their pain. We also look at their depression and anxiety scales, which are really important in the whole management of pain. And putting all of those together, it brings into importance the approach that the Faculty of Pain Medicine, which is the peak body for training and validation of specialist pain medicine physicians here in Australia and New Zealand, have. They talk about the psychosocial biomedical approach to the management of pain. We used to talk about the biopsychosocial, but now we talk about the psychosocial biomedical, putting the emphasis on the social and the psychological and the medical in the appropriate order.
So how do patients tend to define pain?
It's so difficult for patients to actually put into words an experience that they know all too well. And pain can occur in the head, and we call it a headache. We can talk about a toothache and it's pain, period pain, or a twisted ankle, a sore back, or a strained shoulder. And all of them are different experiences. So we ask the patients, what does the pain feel like? And they can give descriptions of a dull ache, or a burning sensation, or a tearing sensation. And putting all of these descriptions together, we can come up with an idea of what is actually generating the pain. This was developed in the 1970s using a scale called the McGill Pain Questionnaire, trying to put together the descriptors which would identify a nociceptive pain, a neuropathic pain, a visceral pain. And we can come and talk about each of those in turn over the next number of sessions. But the descriptions that the patients give are essential to trying to work out what type of pain they're talking about. There are various different scales we can use for neuropathic pain and different scores that we can attribute to shoulder activity, to lower limb ability, etc. And there are a whole variety of headache scales. But by and large, the story that the patient gives you, using very selected important questions and allowing them to develop their descriptions, is the most important thing. This is something that we teach our clinical fellows when training to be specialist pain medicine physicians at our faculty.
So are there different types of pain that people experience, and is it likely to change over time? Does it tend to change over time? And I guess the other question is, is pain actually physical, or is it in your head?
Well, taking those in reverse order, is pain in your head? We can furiously agree with the patient when they say, people think it's in my head, because your sensory cortex is in your head. Your sensory cortex is part of your brain. And all of the other subdivisions of the brain and the important centers of the brain, which change and modulate and experience the pain from a human perspective, are all in the brain. But that is not to say it is in the patient's imagination, or that they are deliberately making up a story. There is nothing to be gained by being in persistent pain. There are different types of pain. We define them as being nociceptive or neuropathic or visceral or headache or mixed, and various different types of pain present in different ways with different descriptors. And we look for those descriptors to try to separate out the different types of pain. There are questionnaires that we use, there are scales that we use, and there are examination techniques that we use. And all of these are taught and learned when people are presenting for and accomplishing the Faculty of Pain Medicine examinations, which is the peak body in Australia for training specialist pain medicine physicians. The pain can change over time. Acute pain can become chronic and change in its nature. The pain of back and a back injury can change from being an acute injury, which would resolve in a couple of hours or days, to one that goes on for months or possibly years. Migraine headache, we know, can start in childhood and accompany the patient all the way through their life. And period pain and those sorts of things obviously discontinues at a certain point in people's lives. It also is important to know that the pain changes the way the spinal cord and the central nervous system approaches, accommodates, and experiences.
Interesting. And so when people experience pain, do they experience it in the same way, or do people have different levels of tolerance to the same kind of pain?
The patient's experience is utterly different from one person to another. One very important researcher here in Australia, Mark Hutchinson from South Australia, has stated that every experience we have changes the central nervous system. And the central nervous system is important, indeed vital, to how the patient experiences their pain. Knowledge, background, childhood, injury influences how the pain is experienced, how the sufferer suffers their pain, how the pain is going to be resolved if it's going to be resolved. So the psychological makeup, the physical makeup, the developmental makeup of the patient is of vital importance. And without assessing it in a psychosocial biomedical approach, will not pick up the importance of each of these elements and given the appropriate weight.
So thank you, Dr. McCoy, for this initial video tutorial. I think that's given us a really good understanding of how to define pain and all the various elements that impact on our experience of and our tolerance of pain. So our next webinar that we're going to be looking at is the kinds of specialists who are best equipped to manage pain. So I hope you'll stay with us. I hope you join us for the next video tutorial. Thank you, Dr. McCoy.